Hello everyone, it's Dr. Dave talking with you again today about my experience with transforaminal lumbar interbody fusion. I'm now 3.5 weeks from surgery, and I haven't been able to keep up with my expected updates with you quite as much as I had hoped, but 26 days post-op, it's a good time to give you another update and to try to be an encouragement to other people who are going to be going through this. A lot has happened in the last almost 2 weeks since I posted my last video. You may recall from watching that that I had a deep vein thrombosis upon returning home about a week to 10 days after the surgery, after a long flight from San Diego to New Orleans. But it's doing much better. There's no calf pain at all. There's never been any discoloration from it. I'm still taking the Xarelto. I'm now wearing some compression stockings, which is also a big help in making sure this doesn't come back or cause me any problems further down the road. Swelling is completely gone as well, so that's good news. So nothing more than a big inconvenience in terms of the deep vein thrombosis. In terms of ambulation, I'm up walking every day. I'm able to walk in the neighborhood. Typically I go with my wife a couple times a day to walk the dog. It's good to get out, and we've had a lot of very cold weather lately, so feeling a little bit like a submarine soldier to a degree, but cabin fever is a little bit depressing at times, but it's good to get out, and so I'm able to walk without a walker now, put that away. I still use a cane from time to time just for security's sake. I certainly don't want to fall. Consequences of that would be pretty severe in terms of the back problem, as well as being on the Xarelto, the anticoagulant. So if you feel brave enough to take walks, I strongly suggest bringing a cane with you just to give you a little bit of extra support and stabilization. I am able to sleep through the night now, which is good. I had been early on, within the first week or two, needing to get up at night and take some pain medicine because it would literally wake me up. But that's not happening now. Actually, one of the prescriptions that I got after the surgery from my surgeons was a long-acting pain medication that I only use at night, and that's done wonders to help me stay asleep and be able to get a good night's rest. So I'm able to sleep through the night now. That's a blessing. I have been able in the last week or so to be able to cut the pain medicines in half. It's a huge progress because the pain medicine buildup in your system can cause a lot of problems, and so I'm able to get by on about maybe 3 Percocets per day. I'm hoping to be able to cut that back even more next week. And it's not so much that I need the pain medicines because of the severity of the pain. I need it to be able to stay mobile, because it's very, very important to be able to work, to be able to walk rather, and keep your legs moving. You get a stiffness in your hips and your legs and your ankles just from not moving about as a normal person. So it's, especially at my age, I'm going to be 60 in April, so it's important to stay mobile and to keep active. So I'm taking the pain medicines really more for the issue of being able to get up and move around as I was before. And one of the other reasons to cut back on the pain medicines is that everyone probably already knows this, but narcotic pain medicine can cause severe constipation. Patients can get constipation even after 1 dose of pain medicine. So Um, I've been taking the laxatives and the stool softeners from the beginning, but I got in real trouble with constipation. And it's not a very pleasant topic, but I feel it's important to discuss it because if you get really behind on this, it can be a major uh, problem for you. So keep up with this. I had to use, in addition to the stool softeners and the laxatives, I had to use Fleet's enemas. I had to take magnesium citrate. It was a brutal experience for about 3 or 4 days. Finally got it under control, and now I'm going to be able to keep up with it. But by all means, you don't want to get behind on this. So if you feel like you are getting behind, um, take measures to correct it. Um, I'm still using the ice pack, mostly just for the comfort that it provides. And the swelling is pretty much all gone in terms of my wounds in the back. I'm still using the back brace as well. I think that's a good aid to try to, if anything else, more remind you that you need to maintain good posture. Um, Trying to avoid sitting for more than an hour at a time. Been able to do a lot of work from my desk, from my office, and keeping up with my practice. But um, it's important to stay mobile and to make sure that you get up and from the chair or from whatever activity. Don't do anything for more than about an hour. Change up the routine, and so you'll feel a lot better that way. Um, One other thing that was a great benefit that the physical therapist in the hospital uh, gave us lots of little tools, a little trash grabber to be able to pick things up, and a couple of other little long-handled shoehorns and stuff like that. But one of the things that they gave me, which was tremendous help, has been a tremendous help, especially since I've got to wear these support hose now, is it's very important that you don't have to bend over so much to be able to put on your socks. I mean, it sounds crazy, but all of you have had serious back pain. You know what I'm talking about. It can be a real challenge to put on your socks. So they gave us something in the hospital, which I thought was really nice. And I'm going to hold up the package insert. It's called Sock Aid, and I don't have a website to give you, but this is the package insert from that. See if you can see that. This is the tool which um, the hospital physical therapist gave us uh, for helping to be able to put on your socks by yourself. Sounds like not a big deal, but all of us who have had back pain have struggled with that from time to time and at various levels. So this has been a tremendous help. I don't have a website to give you, but it's an amazing little tool. So if you can find this um, where you work or in your neighborhood, this has been a tremendous aid. I'm still having uh, some pain. As I said before, I'm taking the pain medicine less and less, but I'm expecting to be on some degree of pain medication for about 3 to 6 months. Most people say that it takes about 3 to 6 months to get off of all this stuff altogether. And then with the physical therapy that'll be beginning in about a week, um, it's likely that I'm going to need some comfort in that from the pain medicines. But um, it's getting better and better every day. Um, I've been a little bit depressed on occasion from time to time, uh, but that's getting better as well. I think most of it is just the cabin fever. As I said, we've had a lot of cold weather here. I haven't been able to get out much, and just not being able to get out and do routine things. So it gets a little bit depressing being inside four walls for a lot of times. But family and friends have been great. So I encourage you to make sure that you uh, have visits by friends and try to do a little bit more than just watching TV constantly. That gets pretty old. Um, I'm looking forward this week to being able to go back to the office on a limited basis. I'm going to try to start seeing patients again in the office about 2 to 3 days a week. Um, hopeful that this is going to be therapeutic as well as just catching up on my chores at the office. Later on this week, I'm expecting to have some x-rays done, which I will send a CD to Dr. Kim, and expect to have a telephone conference with him later this week or next week about the results of those x-rays, and also I'll be sending him a questionnaire that he provided me with to assess my physical capabilities and my level of pain and so on and so forth. So I'm hopeful to have another report for you next week as to how that goes. I'm hoping to be back in the operating room in about 2 to 3 weeks, which will put it about 6 to 8 weeks from surgery. That's about par for the course. I've seen obviously lots of other videos, and some other people who had put on videos inspired me to do these because it was very, very helpful to me. One gentleman, I think he's from Vancouver, by the name of Derek Spratt, had done some very encouraging videos back about a year or so ago. If you haven't seen his videos, I think they're very encouraging. He had actually a bigger operation than I did. He had 2-level fusion, whereas I only had 1-level fusion. But he was doing remarkably at 2 weeks and has progressed very well. He's very upbeat. So if you need another encouraging voice, his videos have been very, very helpful to me. So I'm hopeful that I'm going to be able to give you another report in about a week or so. This last 10 days has seen tremendous improvements, both physically as well as emotionally, and I just encourage you to keep up the faith and find a good surgeon, critically important, and do your research. At any rate, I'll try to update you again in about a week or so. Thanks for watching.